Begin with that breaking news because tonight the federal government is preparing to ship out nearly 3 million doses of Pfizer's coronavirus vaccine in hopes that the shots will be given emergency approval by the FDA tomorrow. But just 24 hours after the first widespread use of the vaccine in England, tonight experts are delivering a large dose of reality. Tonight, the British government is warning people who have allergies to foods or vaccines not to take the shots after several people there who were vaccinated had adverse reactions. And back right here at home, there are growing concerns the Trump administration may not have bought enough shots to meet demand for the vaccine over the next few months. And that is putting further strain on a healthcare system already in crisis. Just since our broadcast last night, another 200,000 Americans have been infected with the virus. And what are the first signs of skyrocketing cases caused by Thanksgiving travel? Now, the death toll is growing too. More than 15,000 Americans have been killed by the virus in just 7 days. And with ICUs now overflowing for 1 out of every 3 of us, the nearest hospital most likely doesn't have a bed available if we get sick. We have a lot of new reporting for you and your family, and our team is covering it all. CBS's Nikki Battiste is going to lead off our coverage tonight from New York City. Good evening, Nikki.
Nora, Mount Sinai Hospital is turning this area used for flu shots into vaccine pods. They expect to be able to vaccinate about a dozen people at a time and will have optional observation areas to monitor them for severe reactions. Tonight, England's National Health Service issued an urgent warning. People with a history of severe allergies should not get the Pfizer vaccine. This comes 24 hours after 2 healthcare workers suffered allergic reactions after receiving the shot.
We know from the very extensive clinical trials that this wasn't a feature, but if we need to strengthen our advice now that we've had this experience.
The head of Operation Warp Speed, Sept spoke to CBS News chief medical correspondent Dr. John LaPook about the allergy warning.
Personally, I would go for the caution and avoid vaccinating people with severe allergies.
The U.S. is expected to approve the Pfizer vaccine as soon as tomorrow, and the first vaccinations could begin next week. But its supply won't come close to matching the demand. Pfizer is one of 2 drug manufacturers seeking FDA emergency use authorization. Pfizer and Moderna say they will produce 100 million doses each, which at 2 doses per person would only vaccinate about 30% of the U.S. population.
Is it possible we're going to hit a so-called vaccine cliff where we suddenly find ourselves with not enough vaccine when it comes to be about April and May?
So we are working very hard to prevent that. We are reordering vaccines from Moderna and from Pfizer.
Tonight, CBS News has learned Johnson & Johnson expects to submit their phase 3 COVID vaccine trial data next month, and they will seek emergency use authorization approval in February if their vaccine is determined safe and effective. Oxford AstraZeneca's COVID vaccine, which is 70% effective, could be right behind them.
So this is the area that we've currently been using for our flu vaccination pods.
Dr. Susan Mashney, vice president of Mount Sinai Hospital in New York, says they are hoping for enough doses in the first round to vaccinate up to 7,000 of their 44,000 healthcare workers. As the vaccine becomes available to the general public, do you expect to have people lined up outside this hospital?
We do anticipate that, and we're hopeful that instead of having COVID-19 testing pods, we're going to have the vaccination pod.
Experts say pregnant women, children under the age of 16, and transplant patients should avoid the vaccine until further research is done. U.S. officials say the federal government plans to start distributing about 3 million doses by the end of this week. Nora?
It is beginning. Nikki Battiste, thank you.